Hello friends, welcome back to another episode of Dr. Arya's Vlogs. Today in this lecture, I would like to discuss some diagnostic aids to detect residual ridge resorption. So coming to the various diagnostic aids to detect residual ridge resorption, they are radiographs. It include cephalometric and panoramic radiographs, tetracycline labeling, mercury porosimetry, anatomic studies, Raman-Jig procedure. So the radiographic method is widely used to detect bone resorption and formation by taking periodic radiographs. So the periodic radiographs are taken to evaluate the bone resorption and bone formation. And they are of two types, mainly cephalometric radiographs and panoramic radiographs. So coming to the measurement of residual ridge resorption, it is made for very serial examination of diagnostic cast. Then lateral cephalometric radiographs are most accurate and it measures RRR over a period of time. So these are the various cephalometric radiographs. And this is a panoramic radiograph. It shows moderate to advanced residual ridge reduction in the mandible. Frequently leads to palpable and superficial occlusion of the mental foramina. And this picture shows gross resorption of the residual ridges. So this picture shows gross bone loss of the residual ridges, which is revealed by careful superimposition of portions of two cephalometric radiographs made 16 years apart. So these are the two cephalometric radiographs which made 16 years apart. So here the gross bone loss of residual ridges revealed. Okay, and the actual bone loss in the anterior part of the ridge of the mandible was 13 mm in height and 60 mm square in cross-sectional area. In this picture, it shows that the tracings of three lateral cephalographs with maxilla and mandibles carefully superimposed. Note the changes in the shape of residual ridges following the extraction of remaining teeth 50 months before. Okay. So here the careful superimposition of portions of tracings of these lateral cephalograms has clearly shown the gross reduction of bone in size and shape that occurs on the external surface of the labial, crestal and lingual aspects of residual ridge. And this picture shows the panoramic radiograph showing severe residual ridge resorption in both maxilla and mandible in marked contrast to the dentulous area that supports three mandibular teeth. So here marked residual ridge resorption in both maxilla and mandible, but here it is less. Okay, in the area where the teeth present, the resorption is less. So coming to this picture, it shows that the radiographs of mid-sagittal sections of 8 mandibles illustrating various orders of residual ridge form. Okay, so these are the pre-extraction, post-extraction and high well-rounded. Okay, pre-extraction, post-extraction and high well-rounded. And here it is the knife edge, then low well-rounded, with and without cortical layer on crest of the ridge and depressed without cortex on the crest. So these are the radiographs of mid-sagittal sections of 8 mandibles illustrating various orders of residual ridge form. And here in this picture, it shows the YCurrentSleep method. It uses panoramic radiographs for the evaluation and classification of mandibular resorption. This is a method of predicting original alveolar truss height. It is based on a measurement of distance from inferior border of the mandible to the lower edge of mental foramen. So the simplest method is that the original bone height is equal to 3 times the distance from inferior border of mandible to the lower edge of mental foramen. This picture shows the graphical representation of Carlson cephalometric analysis of residual ridge resorption and Dahlgren's table depicting longitudinal rate of resorption. So in this picture, it shows that the Carlson and Persson in 1998 did a cephalometric analysis in 34 patients and found that there was a dramatic loss of bone during the first year after a tooth extraction that continued over the years even without a denture on the tissue surface. In the second picture, it shows the Dahlgren's table depicting longitudinal rate of resorption. So here in 1972, Dahlgren showed denture wearers that have continued bone loss over the years. So the denture wearers is seen in this green marking. So here the denture wearers have continued bone loss over the years. And this is the next diagnostic method, that is the tetracycline labeling. So the tetracycline, which is injected into the body through oral or parenteral administration, and it should be repeated after every week for 5 weeks. And this tetracycline is taken up by the bone only in the new sites of bone formation. Tetracycline can be readily identified in the bone as tetracycline calcium chelate formed, which is fluorescent and can be viewed by fluorescence microscopy. So this is the picture showing tetracycline labeling. So next method is that mercury porosimetry. So it is used to determine the quantitative importance of osteocytic resorption, and it was used to make a comparison between osteocytic and osteoclastic bone resorption. So this picture shows the mercury porosimeter, and this is the method which is used. So here the mercury is introduced into the pores by pressure, and it is a measure of pore volume as a function of pore diameter is obtained. So this is the mercury porosimetry. Dahlgren, Atwood and Coy studied rate of residual ridge resorption for 25 years. Mean ratio of anterior maxillary residual ridge resorption to anterior mandibular residual ridge resorption was 1:4. So RRR is more in mandible than in maxilla, and reverse can also occur. So one must treat the particular patient, not the average patient. So coming to various treatment modalities, due to this continuous process, a maintenance phase comprising of relining and rebasing the dentures is essential throughout the life of a CD patient. Lower dentures help in minimizing the ridge resorption and contribute towards the enhanced retention, stability, support of the processes along with the preservation of proprioception. So clinicians must try to retain the residual roots whenever possible. And severely resorbed ridge may require vestibuloplasty, but prosthetic rehabilitation with osseointegrated implants is the best solution to prevent this process and preserve the bone. So that's all about the residual ridge resorption in detail. Subscribe for more videos. Thanks for watching. Stay home, stay safe.